Ladies and gentlemen, would you rise and join me in welcoming Mr. GAN Kim Yong, our guest of honor, Minister for Health. Please be seated. Good morning, ladies and gentlemen. Welcome to the 2011 NIHA Forum, Combating Chronic Disease in Asia, Gaps and Innovations. I'm Dr. Rajaraman. I'm a research fellow in the Saw Swee Hock School of Public Health, National University of Singapore. May I now invite Professor Tan Chuan up to the podium to deliver his opening remarks. Professor Tan Chuan is the President of the National University of Singapore.
Good morning, our Minister for Health, Mr. GAN Kim Yong, Ms. Janice Armstrong, the Regional Director of GSK's Asia Pacific Regional Director, colleagues, distinguished guests, ladies and gentlemen. Let me bid you a very warm welcome to this second NIHA Forum. Singapore is famous for its acronyms, so in case you weren't aware, NIHA stands for NUS Initiative to Improve Health in Asia. This was set up in 2010 with the very generous funding support from the GSK EDB Trust Fund. The broad overall goal is to contribute through research, education, and work that informs policy and action to the improvement of public health and healthcare delivery in Asia. NIHA is coordinated by the NUS Global Asia Institute in collaboration with the Lee Kuan Yew School of Public Policy, the Yong Loo Lin School of Medicine, and the NUS Business School. I'd like just to give you a very brief introduction to NIHA, particularly for our colleagues who are new to this forum. NIHA is essentially got three linked components or legs, namely research, a leadership program, and the NIHA Forum. For the first leg, which is research, our goal is really to try to promote and support collaborative work between researchers in Singapore and Asia on health-related issues of high priority to this part of the world. We hope to generate data and insights which will help us better understand key aspects of health in Asia, and at the same time help progressively build a strong network of healthcare and public health research collaborators in this region. A quick update, the first grant call was launched in January this year. We had over 60 proposals from all around Asia, encompassing a wide range of topics such as comparative health systems, healthcare financing, infectious disease control, and prevention of non-communicable diseases. Following a three-stage review process, 11 projects were selected for funding, and many of the lead investigators of which are with us today. So to all our research award recipients, my heartiest congratulations. NIHA's second leg is the leadership program, and this program comprises an intensive two-week component in Singapore, taught by faculty from our public health school, business and public policy schools, as well as invited overseas and local experts. During this two-week period, participants also define a project which they will address on their return to their home countries. And the selected participants will then come back to NUS the following year to share and discuss their findings as part of an advanced one-week module. The inaugural NIHA Leadership Program was held from the 17th to 28th of October this year, and we were really heartened by the strong response with participants which included policymakers and public healthcare leaders from 10 countries in Asia. The key themes addressed in the leadership program were leadership and change, healthcare decision-making, program and policy implementation and stakeholder management, health promotion and communication, and social and public healthcare marketing. I'm glad to report that we have just completed this first leadership program, and the feedback from the participants was really very positive. Several have also indicated that they will recommend the course to their peers and deputies for which we are very grateful. The participants have selected a variety of topics for the projects that they will embark upon when they return to their home countries. These topics include areas like tuberculosis control, anti-smoking and tobacco control, as well as control of type 2 diabetes. And they will be proceeding with these projects with help and advice from faculty mentors. As I mentioned, each participant will work on these projects from now until July of 2012, and at which point in time they will actually return for the one-week advanced module in NUS. The third leg of NIHA is this NIHA Forum, and several of you were with us for the inaugural forum last year, which we felt was very successful. In that first forum, the main focus was on defining the most important priorities in health and health systems development in Asia, which we felt would help inform the general research directions of NIHA, as well as the content of the leadership program. So for this year's NIHA Forum, with the theme of combating chronic disease in Asia, we will be continuing one of the most important discussion threads from last year. And as with last year, this forum hopes to foster partnerships between the key health policy makers and thought leaders in Asia by identifying critical issues, sharing innovative approaches, and working together towards more sustainable solutions. Our participants come from all across Asia, from the health ministries of Brunei, China, Malaysia, Laos, PDR, India, Thailand, Hong Kong, Philippines, Vietnam, Cambodia, and Singapore. We are really grateful to you for your strong support, and we really are looking forward to the many fresh insights and perspectives that you will bring and contribute to this forum. As we all know, effective national strategies for the prevention of chronic diseases require a multidisciplinary and multisectorial approach, encompassing health and non-health related government agencies, community organizations, and the private sector to create an environment that facilitates the adoption of healthier lifestyles. This is why the NIHA Forum encourages participants from the public, private, as well as NGO sectors. And this is why also, as you will partake of your meals through the course of the forum, you will notice that they're all extremely healthy, because we have worked quite hard with the Health Promotion Board in Singapore to make sure that we live up to our theme of this conference, which is to combat chronic non-communicable diseases. So for example, it would be brown rice and brown rice noodles that will be served as the main carbohydrate portion. I also wanted to take this opportunity to let you know that since the last NIHA Forum, a major and exciting development in NUS has been the establishment of the new NUS Sawsey Hawk School of Public Health with Professor Chaki Singh as inaugural dean. Clearly, the formation of this school will substantially enhance the public health faculty, expertise, and research base within NUS, which we hope will in turn contribute further to the growth and development of NIHA's key thrusts. I'd like to close by once again thanking all our participants for enriching our forum with your presence. My special appreciation to the members of the NIHA International Advisory Board, Professors Harvey Weinberg, Walter Willett, David Heinemann, Paul Zimmert, E.K. Yeo, Chris Henschel, Bill Showalter, and Professor Yang Hongwei. We thank you for your wise counsel, strong support, and presence at this forum. I also wanted to express my deep appreciation to Professor Seethram, the Director of GAI, who has been instrumental in orchestrating and coordinating all the complexities of organizing this forum. Finally, I'm indeed very grateful to our Minister, Mr. GAN Kim Yong, for so kindly gracing this event as our guest of honor. And with that, I would like now to invite our Minister to please address us. Thank you.
Professor Tan Chorh Chuan, President of NUS, Professor Harvey Feinberg, President of Institute of Medicine, United States of America, distinguished guests, ladies and gentlemen, good morning to all of you. I'm indeed honored to address you this morning at the opening of the second NUS Initiative to Improve Health in Asia, NIHA Forum. This year, NIHA's theme is Combating Chronic Disease in Asia, Gaps and Innovations. The focus on non-communicable diseases, or NCDs, is an apt and timely choice, considering the severe challenge posed by NCDs to societies. This has been recognized by governments worldwide, and just recently, in September, the United Nations convened the high-level meeting on NCDs, making it only the second time in history that this august body has addressed a significant health issue. The other was the AIDS epidemic a decade ago. NCDs are a growing concern worldwide and is the leading cause of death globally, accounting for more than 60% of all deaths. Significantly, NCDs are no longer diseases of the affluent nation. The idea that only the rich and developed countries are affected by NCDs is a myth that needs to be dispelled. In the WHO Western Pacific region, NCDs are responsible for 4 out of every 5 deaths, with 80% of these deaths occurring in the low to middle income countries. The enormity of this problem is made clearer when one takes into account the interaction between 2 major demographic trends, that of an increasing world population coupled with that of an aging population. The proportion of those aged 60 years and above is increasing and is expected to remain so. At the same time, it is recognized that NCDs affect older people disproportionately. Therefore, the incidence of NCDs can be expected to increase rapidly in the future. Singapore, too, is not spared from this phenomenon. NCDs such as heart diseases, stroke, cancers, diabetes, mental disorders, and chronic respiratory diseases constitute more than 60% of our burden of disease. We expect the number of Singaporeans with NCDs to grow over the next 2 decades as our population ages. The effects of globalization, urbanization, and lifestyle changes are also exacerbating the NCD epidemic. People are eating less healthily because traditional dietary patterns have been replaced in favor of the Western diets that are dominated by higher intakes of meat and lower intakes of vegetables. The situation is made more complicated as this change in diet is also accompanied by aggressive marketing of unhealthy foods high in fat, sugar, and salt. And sad to say, many of these marketing strategies are targeted specifically at the more vulnerable populations such as our children. Urbanized societies are more sedentary, with people engaging in less and less physical activities, and they have become more obese as a result. Aside from a sedentary lifestyle and an unhealthy diet, the use of tobacco and that also contributes significantly to the burden of NCDs. NCDs not only pose a cost to the individual patient and his family, but also on healthcare systems and economies. Economists suggest that each 10% rise in NCDs is associated with 0.5% lower rates on our annual growth rate. According to a recent study conducted by the World Economic Forum, together with Harvard School of Public Health, the cumulative cost of heart diseases, chronic respiratory diseases, cancer, and diabetes in lower-income countries are expected to exceed $7 trillion in the next 15 years. This comes to an average of nearly $500 billion a year. This is not a paltry sum at all, and only serves to underline the significance of NCDs in today's world. However, behind every dark cloud lies a silver lining, as lifestyle risk factors contribute significantly to the development of NCDs. They are preventable to some extent. In our fight against NCDs, the greatest good can be brought about by focusing efforts on preventing the development of the disease itself, rather than managing the complications after its occurrence. Tackling the risk factors common to many of these diseases must be given top priority, and healthcare systems must be upgraded or modified to deal with the considerable challenge of controlling these risk factors. As they say, prevention is better than cure. And we are gathered here over the next 2 days to discuss how best we can deal with the problems of NCDs, especially in the context of Asia. One thing is for certain, the health sector cannot remain isolated in fighting this battle against NCDs. Our colleagues in clinical care have come to acknowledge that interdisciplinary teams produce good outcomes by being able to draw upon the wide array of knowledge and skills from various healthcare disciplines in managing the needs of an individual patient. Likewise, the health sector must also recognize the importance of working with other sectors in tackling the NCD challenge. The health sector can begin by reaching out and enlisting the support of our colleagues in agriculture, the food industry, pharmaceutical companies, urban planning, transport, and education, and other sectors to form a united front for the public's health. While these industries and sectors might seem disparate and unrelated, common goals can be found to establish partnerships that can improve public health. For example, in Singapore, our Health Promotion Board's Center of Excellence for Nutrition, Chuan, is collaborating with the Singapore Food Manufacturers Association to make healthier food pervasive. Together with SFMA and Spring Singapore, Chuan's new Finest Food Program, Finest stands for Functional, Innovative, Nutritious, Effective, Science-Based, and Tasty. Finest Food Program, quite a mouthful. It will take the lead in equipping our small and medium enterprises with the knowledge and skills to develop functional, healthier products. HPB also launched the Healthier Hawker Program in April this year, where their team worked with the hawkers at the Yuhua Market and Food Center to sell healthier food choices. For example, by using whole grain noodles and brown rice in their dishes instead of the usual yellow noodles and white rice. They were careful to develop healthier food products that look and taste exactly the same as the original. This switch has proved to be a win-win strategy. Since the introduction of the healthier food choices, the hawkers there have reported a 20% increase in sales, demonstrating that there is indeed a strong business case to sell healthy food. These are just a few examples of intersectoral collaboration. We will need more of such innovative solutions that can lead to the betterment of our population's health. Intersectoral cooperation does not always come easy though, and this is where a whole-of-government approach is necessary. Governments can play a key role by being a driving force in the formulation of intersectoral policy and implementation of interventions. Government agencies are best placed to oversee the reform of policies, legislation, services, and infrastructure to tackle the rise of NCDs. In addition, there is room for regional cooperation and collaboration and to share knowledge and best practices across systems and sectors and countries. Context of each country and its own health systems, and based on sound data and evidence. Governments, therefore, also need to work in close conjunction with prominent academic institutions that are able to provide reliable data and a strong evidence base for policy and action. With this in mind, I'm happy to note that the NUS Sosui Hock School of Public Health was launched last month. The School of Public Health is an extension of the former Department of Epidemiology and Public Health and will focus on bringing different disciplines and different sectors in the community together to study and address the prevention of common health problems, including the NCDs. Just as the Sosui Hock School of Public Health intends to promote intersectoral collaboration and establish regional networks, similarly, NIHA, which was established last year through the GSK EDB Trust Fund, is an innovative platform to bring together government leaders, academics, and industry representatives. NIHA comprises a high-quality portfolio of cutting-edge research, high-level forums, and leadership programs. It reflects the direction that health policies are heading in the future. by integrating leadership and research to aid in the formulation of sound health policies. NIHA's work complements that of the new School of Public Health. Together, NIHA and the School of Public Health can form research collaborations with other countries in the region and can benefit all involved and contribute to building public health knowledge and capacity in Asia. This forum is therefore an ideal representation of the intersectoral collaboration that NIHA promotes. As leaders in healthcare and public health, I believe that by working together, we can mount strong efforts against unhealthy diets, physical inactivity, tobacco use, and other risk factors. This is the time for a comprehensive and sustained collective response to NCDs. Our goal remains, as always, better health for all our people. On this note, I wish all of you a productive and fruitful 2 days workshop and seminar. Thank you.
Thank you, Mr. Dunn.